name's Charlie. I'm gonna be one of the nurses taking care of you here today, okay?
Okay.
I'm gonna wash my hands really quick. I'm here to do a full assessment on you. And so what that means is I'm gonna look at everything from your head all the way down to your toes. Is that okay with you?
Yes.
Okay. So are you in a comfortable position before we start?
Yes.
Okay. Starting with your head, I'm gonna ask you to verify your full name and your date of birth for me.
Page Miguel's 82901.
Okay, and your bracelet matches that. We're good there. Do you know where you're at today?
The hospital.
Do you know what day it is?
September 19th, 2022.
Okay, perfect. Patient is alert and oriented ×4. The next thing I'm going to do is feel around your head for any lumps or bumps and then squeeze your forehead to check for skin turgor, okay? I don't feel any lumps or bumps. I don't see any lesions. Okay. Skin turgor looks great. The next thing I'm going to do is shine this light into your eyes. It's really bright, but try to keep them open and focus on my nose for me, okay? Good, and then focus on the pen light for me. Perfect. Pupils are equal, round, and reactive to light and accommodation. Give me a big smile. Good, ears are symmetrical. I don't see any facial asymmetry. I'm now going to shine this light into your mouth to look at all of your mucous membranes, okay? Good. Teeth look great, lips are pink and not cracked, and your mucous membranes are pink and moist. So everything is looking good up there. Are we having any headaches or any?
Some congestion.
Okay, so we have you on some meds here for allergies. Is it working?
Yeah.
Good. We'll get to talking more about that when I'm done with your assessment, okay?
Okay.
All right, so I'm gonna move on to your arms next. You're gonna feel the backs of my hands. I'm checking for your skin temperature, okay? Good. Skin is warm and dry. I'm gonna check your pulses. Radial pulses are +3 and strong bilaterally. The next thing I'm gonna do is squeeze each of your fingertips. I'm checking for circulation, okay? Good. Capillary refill is less than 3 seconds bilaterally. Now I'm gonna check your strength. So what I'm gonna have you do is grip each of my fingers like this with both hands, okay? Good, and then pull towards you and push me away. Perfect, you can go ahead and relax. Strength and resistance are strong bilaterally. Now I'm gonna have you raise your arms up to the sky like this and bend at the elbows and then go ahead and relax. Any pain or difficulty doing those movements?
No.
Okay, perfect. The last thing that I have to do for your arms is check your sensation. So what I'm gonna have you do is close your eyes and then verbalize where you feel me touching you with my pen light, okay?
Left arm. Left hand. Right hand. Right arm.
Perfect. Sensation is good on both arms. Now I'm gonna take a listen to your heart and your lungs. So I'm gonna start with your lungs on the front and a couple places on the side. And for that, I'm gonna have you sit up where you are in a comfortable position for you. And then the way we're gonna do this is every time that I touch my stethoscope to your chest, I want you to take a deep breath in and out through your mouth, okay? Sorry. I'm gonna move on to this right side, okay? Good. And then this left side. Perfect. So your lungs on the front, anterior lobes sound good and clear. Same for your sides. Your lateral lobes sound clear as well, okay? The next thing I'm going to do is listen to the back side of your lungs. So if you could swing your legs off the bed for me. And then same thing here for the breaths. Every time I touch my stethoscope, in and out through the mouth, okay? Good. So your posterior lobes of your lungs also sound clear. I don't hear any abnormalities in any places for your lungs, okay? The next thing that I'm gonna have you do is go ahead and get back in your comfortable laid back position. I'm going to first inspect your chest and look for any wounds, scars, or abnormalities, okay? I'm gonna scoot the strap of your sports bra over to visualize that, and then squeeze your chest up here the same way that I did your forehead, okay?
Okay.
Good. Your skin interior looks great, no signs of dehydration, and I don't see any scars or abnormalities that are visible on your chest. Is there anything that I'm missing that you know of for like skin abnormalities here?
No.
Okay. The next part is listening to your apical pulse. So what that is I'm gonna go, you'll feel me pressing to find your fifth intercostal space, the spaces between your ribs. So I'll feel down until I'm in that fifth space, and then I'll make sure that I'm centered on your left mid-clavicular line. Once I find that place, I'll place my stethoscope there and listen to your heartbeat for 1 full minute, okay?
Okay.
So, 1, 2, 3, 4, and 5. It's here. Perfect. So your apical pulse rate is 68 and regular. You have a good S1, S2, and I don't hear any abnormalities there, okay?
Okay.
The next thing I'm going to do is take a look at your stomach. So what I'm going to have you do is slide down so that you're laying kind of flat in bed and expose just your stomach for me. All right. So first taking a look, I don't see any abnormalities, no scars or wounds, and no visible masses. The next thing that I'm going to do is take a listen to your bowel sounds, okay? Good. So bowel sounds are active in all 4 quadrants. The next thing that I'm going to do is palpate. So I'm going to press lightly in a few different spots. I want you to tell me if you feel any pain or discomfort with this, okay? Any pain or discomfort there? Good. And I didn't feel any masses or abnormalities when I was doing that either, so everything looks good there. The last part is your legs. So you can go ahead and get back up in a comfortable position that's good for you. Awesome. And then what I'm going to do is pull the blankets up to expose just your legs, okay? Okay. So your legs are essentially the same as your arms. You're just going to also feel me squeeze. So first, skin is warm and dry. I don't feel any edema or swelling. I'm going to feel the 2 pulses on each foot, okay? sacroiliac pedis pulses are +3 and strong bilaterally. We're going to go to these ones behind your ankles. Posterior tibial pulses are also +3 and strong bilaterally, looking good there. Next thing I'm going to do is squeeze all of your toes just like I did your fingers, okay? Good. And capillary refill is less than 3 seconds bilaterally. The next thing is the strength and resistance. We just do it differently for your feet. So what I'm going to do is place my hands on the tops of your feet and I want you to pull me towards you, okay? Good, good, good. And then press down. Perfect. Go ahead and relax. Strength and resistance is strong bilaterally. Excuse me. The next thing we're going to do is range of motion. So what I'm going to have you do is pick up this right leg and then bend it at the knee and relax for me. Same thing on the left, pick it up and bend at the knee and relax. Any pain or difficulty doing those movements?
No.
Good. Full active range of motion for bilateral lower extremities. The last thing that I have to do is the sensation. So again, you'll close your eyes, no peeking, and then tell me if you can feel where I'm touching you, okay?
Right leg. Left foot. Left leg. Right foot.
Perfect. That looks good. So we're all done here. I'm going to cover you back up, okay? That concludes the assessment portion. Did you have any questions?
No.
Okay. Everything looked really good. When we were up at your head, I told you we would talk about the allergy medications that you're on. So we are sending you home with the same medications that you're on for your allergies here because they're effective and they're working for you.
Okay.
So you're on the Allegra and Benadryl with the saline nasal spray as needed. So what you're going to do at home is take the Allegra once a day in the morning, just one pill, okay? It doesn't make you sleepy or anything like that, so you can take it, go to work, do your normal daily activities with that medication. And then at night, you can take the Benadryl because it makes you sleepy, so we don't want you taking that one during the day. So Allegra in the morning, Benadryl at night, and then the saline nasal spray is kind of as needed. You can use it every 4 to 6 hours if you're feeling any nasal congestion that you want to clear up. Any questions about the medications?
No.
Okay, can you repeat back to me how you're going to take them?
So Allegra, once in the morning, just one pill. Benadryl at night because it makes you sleepy, and then the nasal spray as needed every
Perfect.
4 to 6 hours.
Perfect. So I'll be back to check on you in about an hour. Do you have any questions for me?
No.
Okay, just gonna clean my hands and then clean my equipment. Before I head out, in case you need anything within the hour, that is your call bell. If you need or want anything, can I grab you anything while I'm out?
No, I'm good.
Okay, perfect. All right, I'll be back to check on you in a little bit, okay?
Okay, thank you.
You're welcome.